And we are live.
Live from Las Vegas.
Yeah, it's interesting. We set this thing up yesterday. Sorry, on Wednesday. And I was like, hey, we're going to be doing some lives. And yesterday turned into a cuckoo day. And today hasn't been all that much better.
Why was yesterday so cuckoo?
Well, I guess if people haven't been hiding under a rock, they would know that I did a live surgery in front of 7,500 people yesterday on this beautiful man right here. And we did his lower arch. We removed his remaining teeth.
I love it.
We removed his remaining teeth, and we placed 6 implants and did an immediate load. We ended up utilizing 5 of the 6 implants. So I figured we could bring him on, talk to him, ask him some questions. So Mark, tell us what led you to the point of where you are needing your teeth to be done.
Well, basically, I contracted diabetes.
Okay.
And that really tore them up. And I think there's some hereditary stuff going on there, too. And so I had an upper and lower partial, as you know, and you got in hold of me and said...
How long did you have those partials?
Probably 10 years.
Same partials?
No, the lower one was the same. The upper one I had replaced.
And what did you think about the partials?
They were adequate, but they were embarrassing.
Okay, what was embarrassing about them?
Well, because, they could slip, and, people could probably look at me and tell. I didn't smile a lot. I didn't make eye contact, and that's all going to change.
Yeah, not going to change. It's already
changed. I mean, people around this show have been, super complimentary about you, about your staff, and about how good my teeth look. And I mean, I've had just strangers just walk by and kind of look at me, and then one girl said, "Hey, you're the guy from yesterday." I said, "Yes, I am." And she said, "I can't believe you held your mouth open that long." I said,
it's an acquired skill.
It's all worth it, believe me.
It's an acquired skill. So let me ask you this: what took you so long to get something like this done?
I just didn't, wasn't ready for the expense, and I really thought it was going to be a lot more time consuming.
Okay.
And basically, you told me what you were going to do, how it was going to work, and what I needed to do afterwards, and boom, 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 everything worked. I mean, I haven't had, any swelling. This is the only bruising I've had is these little 2 places, and that's not bad.
I mean, not at all. I was, quite frankly, I was shocked.
Well, I know when I walked in that Tuesday, you were like, "Oh my God!"
I was checking out if you had any makeup on this.
No makeup, no makeup. I'd have covered up this bald spot if I did.
Yeah. So, all right. So to kind of give people an idea, we did Mark's upper teeth at the ADA
1 month ago today
in San Francisco as part of a live demonstration there. We removed your remaining teeth, placed 6 implants there, loaded all 6 implants in front of an audience about 150, 160 people probably, and they were watching us do it the entire time.
Exactly.
And then we did the lower arch yesterday.
Correct.
In front of 7,500 people, and they were watching us in 15-minute spurts do it. As from a patient, what was it like having? What was it like, hearing that? Because we're having conversations about what we're doing to you, some of the challenges we're having. What was it like as a patient hearing us talk about some of these things?
Well, some of it I knew what you were saying, some of it I didn't, but and not to. Well, I'm going to pat you on the back because I had the complete confidence in you and your staff. I mean, I've never seen a group of people work that well together.
Yeah.
And, you told me right from the start, you said, "Hey, we may run into a problem, but I've run into other problems." You said, "I know how to get around it.
Yeah.
I know how to fix it." And I heard you speak in Orlando 5 years ago, and right then I was sold. I knew if I ever got a chance, you were my man.
All right. Well, I appreciate it. It's been an honor. Let me tell you, you have made doing this so easy in an environment that was, quite frankly, not so easy to do it.
A little challenging.
Yeah, and you were great. What do you think for you was the difference between San Francisco and Vegas?
Well, it was quicker here.
Okay.
We were only in there from 8:30, something like that, till 1.
Yeah, we were at the site that long.
Yeah.
We were actually doing the work from about 9:30 to about 12:30.
Right.
Yeah.
And in San Francisco, it was a little bit longer, but we had problems with the suction.
Yeah.
And, little things here and there.
Working in a ballroom versus working in a dental office.
But hey, you did get a standing ovation.
Yeah, I did.
I was impressed.
They say I got it.
No, I asked some people yesterday, and they said, yes, you did get a standing ovation.
That's
I said,
awesome.
He deserved it.
Yeah, I deserved it.
Yeah, you did.
Yeah. Let's be
JP,
honest.
what's your thoughts? You're doing this type of dentistry. Talk to me about it.
Yeah, so I think some of the things that Mark just hit on really are what resonate with me about why we've been able to implement this in the practice, because bringing this type of work into the practice takes a lot of coordination. It takes coordination with the team, both in the clinical area and the front office, because there's a lot of moving parts.
Oh, yeah.
We've got to plan this thing out. We've got to get it ready in advance. We've got to get all the work done up front so that the day of surgery, the patient's not noticing any of the stress or the concern we might have. And, having the skill set to manage and navigate the issues that come up, that's probably the biggest thing about this type of work that doctors have to be ready to do. Right?
But I think part of it is the pre-planning, having that confidence of, when we're doing the plan, like I could, so to a certain degree, predict, like I knew getting some of the teeth out were going to be complicated, right? I knew that, hey, I'm going in
pretty
this
easy.
Well, a little bit of a cheat there. I knew that there was 2 implant sites I was a little worried about. Yeah. And they both turned out to be exactly what I thought. Yeah. One was a little bit worse than I thought. The one was, hey, worked out a little bit better than I expected. So, all of those things are, Sully Sullivan says, missing y'all. And I'm going to respond to him and saying, why in the hell is he not here at the booth?
Where are you?
Where are you? We're here to work, dude. So
how's the pool?
How is the pool? And so that was nice to be able to see that. Yeah. And then having done enough cases to run through that. I think there's a couple of things that Mark said that I want other dentists to hear about, and that is what. There's not a shortage of people that need it. Okay, so he said a couple of things to me. He said, number one, I thought it was going to be a lot longer and more complicated than it was, because he was probably exposed to 1990s, 2000s full arch implant dentistry, where it was just a different way of doing things. It wasn't worse, it was just a more traditional method. And then the other thing that you said to me was that it made you feel better that I brought up complications. Fun. Instead of saying, hey, it's going to be perfect, when things aren't going to go perfect. So, I think to dentists, you got to, what the hell happened here? Anyway, now this camera's only on me, so I'll move it over here.
God, what a smile.
Look at that.
And so for me, for dentists, is understanding. Patients have done a little bit of research.
Yep.
They know that this stuff is complicated. I've always found that being just honest with people, upfront with them, is always a great policy. And there's some people that don't want to hear it, and that's okay.
Yep.
But those, I don't want to work on them because it's setting unrealistic expectations.
Part of our consultation process with this type of work is we always go through all the steps, right? This is what visit 1 is going to be like, visit 2, visit 3. This is how you're going to feel after week 1, week 2, week 3, week 4. And I'm really upfront with people too, and I say, look, the day after surgery, you're probably not going to like me very much. And that's okay.
That's kind of what you said.
That's okay.
Yeah.
You're probably not going to like me very much the day after. But a week after, you're going to love me.
Yeah. And I actually, San Francisco, we flew out at 9:30 at night. I got home at 6:30 the next morning. And that afternoon, I was out running around doing stuff.
Well, that's not what we recommend.
Yeah. Well, I didn't do a lot of that. I didn't drive.
That isn't exactly what we recommend to people.
I went out and looked at my motorcycle and said, I'll be able to ride you soon.
Yeah. And to me, so I know a lot of Mark's colleagues that work, okay? And to me, I heard from so many of them a consistent theme that you're a different person. You're not fundamentally different, but you're more engaging, and you look people in the eye, and you just have a different. They said you never smiled before.
I didn't smile a lot.
And I don't think you're a bad person, but it's amazing to me because look at him. He's a fun-loving, good person, right? And because he was self-conscious about his smile, it essentially changed his personality. And to me, that's what this type of dentistry is.
That's exactly what this is all about.
Yeah, it's about changing lives. Yes, we make a little bit of money along the way.
That's great.
And we get to satisfy ourselves. But, dude, we look at this. So, John, what'd you think? So you've done and seen a lot of the FP3 cases.
Yes.
What do you think about the concept of doing FP1s here?
Well, I really like the idea of less bone reduction.
Yeah.
Right? That's the number one thing to me. Because first of all, once we cut that bone down,
not coming back.
It's gone. It's not coming back. Second of all, it introduces a lot more chance for complications. Risk of bleeding, bigger flap means more bruising, means more discomfort afterwards. So anything we can do to minimize that is great. But I mean, the final product is going to be phenomenal in this case. Like, I'm already looking at this and like just saying to myself how good this is going to look, because you're going to have that nice tight fit of the tooth up to the tissue with really minimal amount of pink porcelain needed.
Yeah, probably very little.
Probably very little, maybe a little bit on top, probably almost none on the bottom. Yeah. It's...
You haven't seen me do an FP1 case before.
I haven't, no.
Yeah. What was different about the surgery from your end?
First of all, it was the flap.
Right.
That was
the
definitely
lack of the flap.
The lack of flap.
I did a crestal flap, so for people listening.
But the lack of the exposure.
Yeah. The full buccal denuding, basically.
That was significantly.
Especially on the lower, then you're worried about mental foramen.
Exactly.
On the upper, I'm worried about the nerve. the nose. I've exposed nasal sinuses and stuff. So. Yeah, it's some of those things.
Yeah, and honestly, I would imagine in a case where you weren't stop and go constantly like that, it would be a lot faster too.
Yeah, I think we worked pretty much the whole time, didn't we?
Yeah, definitely. Yeah, the only thing I heard was clear, and you didn't even miss a beat. You were right there going.
Yeah.
And it was. I'd advise anybody come and see you.
Yeah, not John. Not John.
Yeah, not me.
And John too. But
maybe if they're north of
the Mason-Dixon line,
north of Mason-Dixon.
I think, to me, what I felt. Okay, I think from my end of things, being 10, 15 miles away, doing this and having an ear plug in so I could hear what was going on. What I recognized were people laughed at some of the things I talked about. People were pretty quiet during the surgery. I joked a little bit, but I felt a aha moment when I had him bite down, and the bite was near perfect.
Absolutely.
And to me, I think that's where people, because that's probably one of the areas that people struggle with the most.
Well, they think about the idea of conversion of a denture, right? Because that's always been the way it's been done. Convert a denture, chairside pickup, have a lab technician out or something, and I mean that's tough. That's just tough. Even with a lab technician there, it's tough. It takes a lot of time, and it doesn't give you quite the same temporization result. The bite is still a little bit questionable with that, but the stackable guide concept is just that's the way to do it.
I think this one went a step further, where the prosthetic was also connected to the Swiss lock pins. So that that really, there was no like, hey, maybe we got this piece off a little bit. We got this piece off a little bit. Everything went into the pins. Into the Swiss locks to make it work. So, I think I was tickled pink.
Yeah.
I don't know if I was pink, but I was tickled. I was tickled. I was tickling myself, actually.
Oh my God,
let's stop there.
Oh my God.
I was pretty tickled to get the result.
Well, it's encouraging to see that's the type of result that we can get with these cases, because I've approached the FP1 concept saying, God, this is something that I'm not ready to do. I don't know that I'm ready to take these cases on. And sure, there's some case selection there, but I think that's going to be the way that we approach these cases moving forward.
Yeah, and Mark was the right candidate, not just as a personality. I'm talking about even from a dental perspective. Yeah. He was the right.
Well, biologically, I mean, he had a lot of good connective tissue there.
Yeah. Well, not even that. His bone was relatively level. Yep. He had, he didn't have 14 teeth. He had, 5 or 6 teeth per arch. So there's, it was just the right situation. All right, Mark, I got a couple of questions for you. Okay. What would you say to dentists that aren't doing this type of dentistry or don't have any of this technology we're here in Vegas for? As a patient, what would you say to them?
I would say that will sell a lot of dentistry if you've got that stuff going. And, when you walk in and everything's, your office is state of the art and it's impressive.
Does that matter?
Oh, yeah. Yeah.
Yeah.
Yeah. I wouldn't want to go to somebody that's using a 20-year-old chair and a over the patient unit that's leaking on me the whole time and stuff.
Is that real? Like, people have that?
Oh, yeah. Yeah. I mean, hey, you go with what you got.
Right.
And you've made the investment in technology. And even one of the people I talked to over at Serrano, they said, well, he was like the first one, wasn't he? I said, as far as I know, yeah. To get everything. I mean,
in our market for sure.
Yeah, and as soon as something new comes out, boom, you're right on it.
Yeah, I've always felt that we should, I don't want to say bleeding edge, and parts of what I do is bleeding edge in a sense, but I've always looked at technology from three perspectives. One is it going to give me better clinical outcomes? Okay. So in other words, I want to do good dentistry, and I'm doing good dentistry. Is this going to help me do greater dentistry? Number two, is it going to be better for my patient in the sense of, am I going to be able to spend less time? Is it going to be more comfortable for them? Am I going to be able to deliver the result faster? That's important to me, to be able to make sure that we're taking care of the patient as well. And then the number three thing I look at is, hey, is it going to unlock potential and increase case acceptance? And is it going to lead to greater profitability? Because at the end of the day, we do run a business.
Right.
And so those things are super important to me to see from a technology perspective.
Yeah, because I can remember the first appointment you were doing the digital impression.
Yeah.
And as you're doing it, you say, okay, I know what I'm doing here. I know what I'm doing. I mean, your mind was working ahead of where we were. You knew exactly what you wanted to do. You had the points already picked out. Yeah. I mean, it impressed me. I mean,
and I didn't start that way. We all start with I still remember doing class ones on those ivory blocks in dental school, and I was like, I can't keep it in. I couldn't do a class one prep.
Can't do the cross. It was all it was. It was the little cross.
And I think I look back to that and I say, man, how we come to a stage where we're doing all of this stuff. It's pretty step by step.
But it's a progression. Yeah. Right. You start with the basic dentistry, get really good at that, refine your presentation skills, all that, diagnosis, and then you can move into some of the advanced things.
Yeah.
Start doing some basic surgeries, grafting, root canals, the things that patients need that don't necessarily want, but they need. And then you can get into things like what you're doing, emotional dentistry.
Yeah.
I mean, because that's
where
what it is.
patients hug you.
That exactly.
Yeah.
First dentist where they want to make you chicken salad and stuff.
Yeah, that's me.
That's what it's all about. I mean, seriously, that's what this whole journey is all about. And I really hope that more doctors hear this and understand
if they have questions
that this is good.
Well, I do know that the first when I went in the second time when we were talking about doing the lower, you said, how are you feeling? I said, I feel great. You said, how are you feeling?
Yeah.
So you wanted to know about my well-being and my health.
Yeah.
And to me, that was like, wow, okay, he's not just going to go in there and slap some stuff in my mouth. He's going to make sure it's going to work.
Well, I feel like I'm married to you in a way because we're doing, this isn't a single crown, even a single implant. We're doing something significant for people, right? And so to a certain degree, I'm vested in your success with this because it reflects on me. So I'm going to know I'm going to see you pretty regularly.
Oh, yeah.
And so I want to make sure that it's a good fit. I don't want problems in my practice. And to me, one of the great things I've done in my career, 90% of the time is you pick out the problems and just say, you know what, I'm not going to participate in that.
Right.
And just say, we're not the right practice for you. And so I don't want to get into something that's going to be problematic for us. It's just not a good thing to do. All right, so here's my other area. I think to help dentists, tell me, what were your fears, not specifically about me? So let's go back 6 months from now, or 6 months backwards, or 2 years backwards. What were your fears? What were you thinking, and what were the fears you had about getting this done?
Well, what I knew originally, because I'm a designer, I'm not selling all this stuff, but back in the day, it was a single implant for each tooth.
Okay.
And that terrified me because that's a lot of dentistry.
Yeah.
But then when you said, hey, this is all in 4, all in 5, all in 6, it's like boom, boom, boom. And it's life-changing.
All right, so what I heard there was that our consumer, our public, isn't aware of the dentistry we're doing. In other words, you at some point from somebody heard that this is the way it's done, and that didn't suit your mind or didn't suit your desires, and then for 10 or 15 years you just assume that's the way it's been done, and that's what it's going to be.
Yeah.
And so we have to do a job of re-educating or re-informing the public about what we're doing. What about the fear of the pain and stuff?
I'll be honest with you. I was a little anxious about that, but, basically you told me exactly what to do when we were done. You said, this is what you got to do. This got to do this. And that should take care of all the problems. And it did. I mean, I went home, I water picked, I did the icing, and I don't eat a bunch of crap anymore, sugar and all that. So, the pain has really been minimal. I mean, this is less than 24 hours.
Yeah.
And I can touch, and it's not like, ow.
How much pain meds did you take the first time?
3 pills.
Okay, so 3 of, I think I wrote, what did I write you? Vicodin? Vicodin, okay. So you took 3 Vicodins.
Right.
What have you taken so far now?
4.
4. So you needed a little bit more this time?
It was a little throbbing yesterday,
Okay.
but once I got the gauze out and put the ice bag right on there, within 2 hours, the throbbing stopped. I mean, it wasn't really throbbing, but you knew something was kind of
It's the
hurting.
heartbeat.
Yeah.
Yeah.
And, within 2 or 3 hours, I was like, oh, man. That's when I told myself, I said, dude, you're coming on the floor tomorrow.
Yeah.
Because, I mean, I want everybody to know what a great job you do, what a great job your staff does.
Yeah.
I mean, I've never felt more welcome in a practice in my life.
Talk to me about that. What do you mean by that?
Well, just, I went to the first appointment, and then I went in for the follow-up check, and walked in, and the girl knew my name. The lady girl behind the desk knew
Lady
who I
and
was.
girl are the same, yeah.
Well, I'm trying to be correct. And
you don't need to be with me.
okay. And as I'm walking down the hall, people were asking me questions, and then you brought another dentist in after we did this, and said, I just want to show them. And they were like the doctor. I think it was a guy from
Hickory.
There you
Dr.
go.
McKinney, yeah.
And he goes, oh, my goodness. He said, usually when I get done with you, it looks like I beat you up.
Well, my patients
and you
do
said the
sometimes
same
too.
thing. But
that, I think that comes from the FP3s, where we're denuding the all the buccal, much of the palate, and then we're flattening
5,
the bone.
6, 7
yeah, so I
millimeters,
think a lot of that comes from that as well. And the surgery is a little bit longer as well. So.
And to be honest with you, people in my office will walk up and just say, hey, man, smile.
Yeah.
And they see me smile and they turn around and walk away. And that really makes me feel good.
All right, so let me ask you this then. And JP, interrupt anytime you want. What were your expectations of the temporary teeth?
I'll be honest with you. I thought these were the permanents. Because when you said, oh, well, the second set, and Chuck did the same thing, said, hey, the second set looks better. And I'm like, how?
Yeah.
I mean, I've sent out 30 texts today of my picture to all my friends, family, and everything, and all I get back is, oh, my goodness. Oh, Lord, I can't believe that. That looks so good.
So I had a lot of these questions during my I did a full arch talk yesterday and a full arch talk today, and I had a lot of questions about, you mean, how often are you immediately loading? I'm like, every time.
Every time.
Yeah, so I think the standard of caring is to try to immediately load.
That should be the
right
goal.
away.
That should be the goal.
What did it have affected you in doing this? And I want you to be honest about this. If we said, hey, you're going to have to wear a denture for 6 months,
I would have done it.
you would have done it.
Oh, yeah.
Okay.
Yeah, I had no problem. I mean, like I said, I've heard you talk before. Yeah. I know your practice. I mean, every confidence in the world.
Yeah. How much? Okay. What do you think about the? So I want to talk about. Let's move on to the Chrome Guide.
Yeah.
Okay. So you don't know about the system we used or any of that stuff. It could have been like any XYZ system, and I often get people saying, "Well, we want to use this system, that system." And look, they're all good. What was your experience with Jay, who founded the Chrome? Because he was there for both surgeries.
Anything that you needed adjusted, he was right on it.
Yeah.
He came in, he consulted with you, and you bounced ideas back and forth, and then he would take it back and do some stuff to it. And right then he was doing it right there.
Yeah.
Yesterday he did have a lab to go to.
Yeah.
And,
which I didn't really love him leaving me.
We all kind of chuckled about that because you're like, Jay. I'm working on a time schedule here.
Yeah, no joke. I'm working on a time schedule.
He said, well, how long do we got? And he said, I think somebody said 5 minutes. And you said, okay, we got 3.
Yeah, we got it. It's like Indian people. So other dentists that are considering a stackable system like Chrome, as a patient, what would you say?
Oh, go for it. Yeah. I mean, they were fantastic with everything they've done. I mean, these teeth feel excellent. I mean, and I'm smiling at people, and I've had people like do a double take, and I
the
like
teeth
that.
aren't far forward, or
Exactly.
they're not canted. I mean,
well, it's because it started with good records.
Yeah.
Right. You had great records. You had a great foundation,
and we had a good plan.
Exactly. Yeah. And I think to me the biggest thing about the stackable type of guide system is the confidence that it gives me.
Yeah.
Right. Because any of the other guides, even a tooth-borne guide, you've got 3-4 teeth that it's sitting on.
Right.
It doesn't give me that same level of confidence, especially with the conversion. Right. Because then you're just guessing. You're guessing on the bite and the vertical. And frankly, I think that's the only way to do these cases.
Yeah, I think I'll never do it any other way.
No.
I'll argue that it takes longer to do it guided, but the prosthetics are so much faster and better. Like so much faster and better. It's ridiculous how fast the conversion is and how much easier making the second set of teeth, his permanent teeth, will be in this case. So, hey, Alyssa, Whitney. Yeah.
Oh.
Right? He's going to keep his own.
Yeah, you keep yours on.
Oh, I was
there.
Give it to Alyssa.
No, she's good. I think I have another one right here. Kind of. All right. Here you go, Alyssa. It makes it nice when we have nice-looking women to work with, right?
Yeah.
So I have Whitney here, Alyssa here.
Where am I looking?
Just anybody you want, us, them, it doesn't matter. What was it like? Okay, so they were my assistants. Alyssa assisted here in Vegas. Liz assisted us in San Francisco. So Whitney, what were your thoughts when I first said we're going to do this live in San Francisco?
He's crazy.
Yeah.
Yeah.
Well,
there's lots of people.
That's a given. That's a given. But from an assistant side, I mean, there's pressure on you too, right?
Yeah. Just getting ready for I had to pack everything and just making sure I didn't leave anything behind.
Is that what?
It's very stressful.
It's very stressful.
Very stressful. Yeah.
Yeah, because I noticed you were less stressed this time for Vegas, I think, than San Francisco. Yeah. Because we worked through and we got to San Francisco, we had everything we needed.
Yeah.
But we did actually not have anything, did we? Was there anything I said, hey, I wish I had this? I think we had pretty much. I think we had too much, quite frankly.
Yeah, we did.
Yeah, and all right.
We did this time too.
Yeah, but you got to. Mm-hmm. What was it like working in a different environment?
It's like cooking in someone else's kitchen. It's very, it's just.
Nothing is where you want it to be.
Yeah.
Like you go to reach for something and it's not there.
Yeah. And smaller.
Yeah. Well, we're fortunate we got big opportunities. But
with the cameras.
And and I'm not trying to disparage any company or anybody's office, but did you notice a difference in working with our Dentsply Sirona treatment centers versus what we worked with in the two different locations that we worked in? Like what? What do you notice? What was the difference?
The suction.
Okay, yeah. The implant motor being built in versus having to have something somewhere else. Yeah. Little thing, like I noticed yesterday, you guys talked about, God, I'm so spoiled that when I put my suction down, it turns off itself.
Stuff like that.
Yeah.
I had to fiddle a little bit to get it down.
Yeah, things were
trying to be
clogged.
quick.
Yeah.
So.
And even things like where the chair movement is and, having presets and not having presets. It's like getting in a car that...
Even the headrest.
Yeah.
I mean, it's
being
the
able
little
to
things.
move the headrest or how easy it is and hard.
Yep.
And to me, that was a big difference as well. Mm-hmm. So a lot of those things don't affect me, right, as the dentist doing the work because, I'm just literally doing the work, right? Mm-hmm. Certainly the implant motor was one thing that affected me,
right.
But the suction, all that stuff doesn't affect me, but it affects you, and therefore it does affect us.
Right.
Alyssa, what was your thought about doing a live surgery in front of 7,500 people and potentially us not going well and getting blamed for it?
I hope I don't drop anything. Was my first reaction.
Good transfers.
Yeah, solid transfers. And I think that was my biggest concern is I hope I don't screw up, noticeably in front of a ton of people.
Yeah.
Yeah.
Well, how many of these cases have you been a part of now?
5. Maybe.
Yeah, maybe 5.
Yeah, this might have been 4, actually.
Okay.
Yeah.
So, what has been your progression from the first? What do you think from the first case you ever watched? I think maybe either Day's office or the surgical center, one of the two.
I was super overwhelmed.
Yeah.
The first time.
What was overwhelming about it?
I mean, there was you and Dr. Rebai.
Yeah.
The patient. There was just a lot going on. It was a very
intense.
And yeah, and it's fast. Everything is very fast. There's a lot of little parts, and I was like, I'm never gonna learn what this is.
And would you say you have a much better idea of what those parts are now?
Yes.
Yeah, like a lot better or
Yeah.
much better?
Yeah, I think much better.
Could you like sub in for Whitney and she could take a day off?
I don't know about that.
We'll get there.
Yeah, we'll get there. I still refer back to Whitney a lot.
What do you think about dentists that don't involve the team in learning these procedures?
I think that's a shame.
Yeah, missing out.
Why?
No opportunity for growth.
Yeah.
Yeah.
For a team member.
Yeah.
Right.
Yeah.
Well, and I mean, how else are you guys, like, we're supposed to make your jobs easier.
Yeah.
If you don't involve us in the training, then we can't get there.
Yeah. And so it accelerates that because you can get there because at the end of the day, you didn't take any training, right?
No.
So you've learned over the times we've done it,
Yeah.
but you've been part of the training and so that accelerates the comfort and the confidence
Sure.
to be able to do it.
Right. I mean, she is my training.
Yeah.
Yeah.
I think we should talk about something else. Mark, and you can make me look bad. It's okay. How often do you actually hear from me?
You personally?
Yeah.
Or your office?
No, I said from
Yeah.
me.
Okay. Well, you gave me your number and everything.
Yeah.
You said call me whenever you need me, but I think that you're so busy doing everything else that, that's the reason Whitney or who was it?
Meredith.
Yeah.
Somewhere. She would text me and say, hey, can you be in here tomorrow morning at 9:30? Oh, yeah.
Yeah. I bring this up because a couple of things. One, I'm not that busy. Okay, it may seem like that, but I don't want. You're right. I give you my number because I'm always there for the patient, but I don't want the relationship to be with me, because then it's just more for me to have to deal with. Right? I'm always there. Okay, but I'm a big believer in making the relationship with the team members and the patient. One, they'll connect better. Two, it takes it off my chest, and three, it buys in the team member. The team members bought into it because you guys like Mark and you know where he's
We
at.
love Mark.
He's making us chicken salad.
Yeah. So you know those things, and I want that. Like with many of our cases, Megan handles that part of it for us, and so I want our team members to be very much in touch with the patient, so that way they can run interference if we have to, or they can smooth things over when we have to. For me, sometimes, that can definitely happen with me. So those things are super important to me, and I wish more dentists did it. Mm-hmm. And then, I've gotten so lazy. I have you guys write my notes for me and all kinds of stuff. Yeah. What else do you guys thinking?
I'm just super happy.
I'm really proud of us.
Yeah.
As a
I shed a
team,
tear
and
when you bit down.
Yeah.
I was like,
I think we all did.
Yeah.
Yeah, really,
It was.
It was beautiful
because it was
so
that was the
perfect.
one thing. Yeah, that's the one thing that every dentist singularly focused on the bite.
yeah,
Mhm.
it was perfect.
And
Yeah.
it was 90% of the way there.
The sky parted. And
Yeah,
it was, just
it
perfect.
was
Yeah.
pretty good. Was it a good experience for you, Alyssa, to experience this?
Yeah, for sure.
Yeah.
I mean, it was, looking back on it now, like we had fun. We had like a positive attitude. There was a lot of planning that, for it to go that smoothly. But yeah, I think it was a great experience.
For you?
Same.
Yeah, both times?
Oh yeah.
Yeah. Yeah. That's good. Yeah.
San Francisco was a little bit more
Yeah, I'm honestly a little glad I wasn't there for that one.
stressful, but it was fun.
Why was it more stressful?
Well, just
The environment?
chair,
Yeah. Ballroom.
150 people.
Yeah, I think people if we were like on a stage doing something,
That would've been way
that would have
different.
been
Yeah.
so much harder. No, like seeing the people looking at me.
Yeah, or them seeing
Yeah.
everything that.
Yeah.
So let's. So I want to be honest about a few things as well here. Okay, how smooth? So there's what people saw. Number one, we did everything live and above board and everything. But was there different? And I'll ask you this: was there a difference in the action level when we were on camera versus off camera?
No.
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 Interesting.
Really?
I
No.
felt like it was a massive difference.
No, you just rolled right from one to the other to the other to the other. And I mean, it was great. I don't hate
I'll
to
send
say
you the check in the mail.
it was a great experience. Yeah. I almost wish that I could do it again.
No.
You've done enough.
We're good.
It was so fun though.
That means we're
You
having.
can just come hang out with us.
Yeah.
I will definitely do that and bring you chicken salad.
Yes, please. Perfect.
Did you feel there was a difference between when we were on and off camera?
Yesterday?
Yeah, yesterday.
I mean,
Oh, I thought so. I felt
absolutely.
I thought we were moving at warp speed when we're off camera,
Right.
And like slow speed
well, and
when
then
we're
the
on camera.
times,
Yeah.
getting started late, which
Yeah.
wasn't a big deal, but I mean, it just kind of
Yeah, it just
we didn't know when we
I
were
think
going
mentally
on.
it was just like, you know, we had a plan, and then it just was like, okay, that's gone.
we had a timeline written down.
Yeah, we were so prepared, and it's like, well, all right, that's done.
Yeah, and you know, for me, the hardest part yesterday was being at the stop points.
Right.
When we're supposed to be.
Right.
Like being at that part of the treatment. And there are times where we were literally waiting on them.
Yeah.
And there are a few times where like, hey, we need an extra couple of minutes.
Yeah.
You know, I think the most we asked for was 5 minutes once.
Mm-hmm.
And I said, because we need to be there. And that's where I felt that's when I felt the pressure.
Oh, absolutely.
I felt the pressure like, hey, I need to be here. And then, you know, we mapped it out where if everything went perfect, we were going to hit those numbers. Not easily, but we were going to hit the numbers.
Manageable.
You know, it was manageable. But as soon as we had anything not go right, you know, then the numbers were
instant panic.
It was a little bit of a panic as well, and so that was awesome. That was tough. I thought that was the toughest part. Yeah. How was the cleanup afterwards? You guys how much time did you spend there afterwards?
Over an hour.
A little over an hour.
Yeah.
Okay. To get everything packed up.
Yeah. Well, and also it's like you're in someone else's office, and I didn't think to ask the day before, like, where's your line cleaner? Where is this? Where is that? You know, so I'm just kind of like snooping, hoping to find some stuff. Yeah. Sorry if it wasn't
Did you find any money? Because we can keep that.
Yeah, I found
some art. We probably found some art for sure.
Yeah, we could.
Oh, God, his artwork is beautiful.
Beautiful office.
Yeah. You guys have any questions? No? No? T-Bone Talks versus Speaks? I don't know. I just went with it. I just saw it and I went with it, you know? T-Bone Steaks because I can't do that.
My head's in the way.
Yeah. So, all right, everybody. Well, we want to thank everybody for tuning in. And Mark, thank you again for making me look good. Yeah, you made us look good, dude. It was awesome.
You look good.
Yeah.
Yeah.
I
You
feel
look great.
good.
Yeah, that's good.
I can't believe how great you look right now.
Yes. What? Oh, it's a good question. So we've had a lot of questions, and I'm horrible about this still to this day. We've had a lot of people ask about learning how to do this type of dentistry, and I have a real hard time saying that we're the best place for it because I don't like the word best. But if you're looking to learn how to do stackable guides, FP1, FP3 type cases, 3D Dentist, 3D-dentist.com. It will be the I4 class, which is our Implant 4, which is our 3D Edentulous class. And we walk through the process of how to plan the case, how to execute the case surgically, and how to execute the case restoratively using a digital workflow. And it's a pretty fantastic program, you know. And so I think it's great. We want you to come and bring your assistant so they can be aware of exactly what's going on and what the parts and pieces are, because there's a lot of parts.
Yeah,
and
there's
pieces.
a lot.
There's a lot.
There's a lot of parts that look the same.
Yeah, a lot of boxes and a lot of expensive
so
parts.
many labels.
You know, like an implant's $300. You drop it, it's $300-400. You know, you know, if we only have 6 temp cylinders and we need 6, you drop it. We're like, we're in a lot of trouble. So I think it's so important to have people, have team members on board with everything that happens. Yeah. I'm so proud of you two.
I really am. Proud of you.
We're proud of
you guys made. Listen, I didn't pack one thing.
You did not.
You know.
You did not. I made that list.
You checked that list 3 times. Yeah.
You know, I was very confident that my focus was the case. Yeah, that's the only thing I had to focus on is the case. You know, I had to focus on making sure, you know, that I presented very well and all of that. But that's enough. To focus on, right? Yeah. You know, that's enough to focus on. I didn't need to focus on, do we have this? Do we have that? You know, do we have, you know, all, I just didn't need, it's not what I needed to be focused on in this particular case. I like that you can
trust me to know that I'm not going to let you fail.
Well, you know, but that comes with time, right? Yeah, that comes with time and effort and good communication. It takes crying.
Yeah, a little bit of crying.
It takes crying sometimes to get there.
Yes, it does.
So, all right. Thanks, everybody. Thank you guys so much.